In a bold twist, Donald Trump has rolled out a deal. 80,000 federal health workers are being offered a $25,000 payout to step away from their jobs. As the government aims to trim its ranks, workers who study diseases, check food safety, and manage Medicare and Medicaid now face a clear, hard choice. In a message delivered straight to their inboxes, employees from Robert F. Kennedy Jr.'s Department of Health and Human Services, working at the CDC, NIH, and FDA, received all the details of this offer. They can start signing up on Monday, but the clock ticks until 5 p.m. Friday to accept the so-called voluntary separation offer. Will they seize the opportunity or hold on to their roles? Trump has vowed to cut down the bloated government machinery once he returns to the White House. To help hunt down wasteful spending, billionaire Elon Musk has been brought in to lead the new Department of Government Efficiency. Back in January, nearly every federal worker got a deferred resignation offer that included 8 months of pay as part of an early DOGE effort to save money. Meanwhile, thousands of probationary staff, including many at HHS, were let go, sparking large protests and a series of lawsuits from upset workers. Is this the calm before a storm of change? A mass email offering the buyout was sent to a wide group of HHS employees just days before agency leaders were set to announce their own plans for cutting down their teams. HHS, one of the costliest federal agencies with an annual budget of about $1.7 trillion, most of which funds health care for millions on Medicare and Medicaid, is now under the spotlight. This comes shortly after Trump told department heads that the final call on staffing was theirs, not Musk's. Will this shakeup reshape the future of public health? Still, Trump warned that if the hard decisions aren't made properly, Musk is ready to step in. If they can cut, it's better. If they don't cut, then Elon will do the cutting, he declared on Thursday. Will agency leaders act fast before Musk takes over? RFK Jr. seems unfazed by the warning, already hinting at deep cuts in his own department. Just last year, he promised to clear out 600 employees at the NIH, the nation's main biomedical research hub. After taking charge, he even admitted he had a list of names he planned to let go. I have a list in my head, Kennedy confessed about the potential firings. He added, if you've been involved in good science, you have got nothing to worry about. If you care about public health, you've got nothing to worry about. If you're in there working for the pharmaceutical industry, then I'd say you should move out and work for the pharmaceutical industry. Who will make the cut when the axe falls? Reports say that the entire new class of the Epidemic Intelligence Service, EIS, was told they were no longer needed as part of 1,300 layoffs at the CDC once RFK Jr. took over. These experts, who investigate disease outbreaks both here and abroad and hold advanced degrees, are some of the top minds in their field. Michael Osterholm, director of the University of Minnesota's Center for Infectious Disease Research and Policy, warned this will destroy the EIS, which is one of the absolute crown jewels of global public health. Can the nation afford to lose such vital expertise? In a surprising move, Trump chose the 70-year-old former Democrat to lead as the nation's top health official, charging him to make America healthy again after dropping out of the presidential race and backing the Republican candidate. Yet Kennedy has faced strong criticism over his past controversial views on vaccinations, abortion, and his support for conspiracy theories. He assured the public that people would still have full access to vaccines, adding that he wanted to study them further to make them safer. If people are happy with their vaccines, they ought to be able to get them, he said. Kennedy also promised to keep American food choices open, even if they're not always healthy. That's what I'm saying, if you want to eat a Big Mac, you ought to, he remarked with a touch of humor. He pointed out that fast food could be improved by cutting unhealthy additives and offering incentives for using beef tallow fat instead of seed oils. We want to do a number of things but not take away choice from people, he concluded. Will his promises bring hope or stir up more debate?